Something coming up called metabolic syndrome. We're talking more and more about it. If you're a diabetic, for some reason, you're more prone to develop high blood pressure. If you're a person with high blood pressure, you're more prone to develop diabetes. You're more prone to develop abnormal lipid levels, abnormal cholesterol levels. This confluence of diseases, multiple diseases in a single individual, we are now calling as metabolic syndrome. These patients stand a very high risk of heart damage. And the predominant problem here again is insulin resistance. Insulin is there in the body, but it's not able to act for various reasons. So the high levels of insulin cause damage. Next slide. Next slide, please. We talked about insulin resistance. It's basically something which eventually damages the body. There are now methods to reduce insulin resistance. The most effective method really today is exercise, but certain drugs are also available which actively reduce insulin resistance. Next slide. Nutrition, we are now looking at it. We have some eminent persons in Pune who have been studying this area very carefully. Dr. Yagnik, a leading diabetologist, has done excellent work in this field and is now being quoted worldwide for his work in this region. Poor maternal nutrition causes serious developmental problems in the baby. Childhood and adolescent nutrition causes heart disease in later years. So you need to address the issue at a very, very, very early stage. The moment a lady gets married, we need to start talking about the next generation's risk of heart problems. So one needs to look very early for this. Again, lack of vitamins, we discussed, causes a high level of homocysteine, which can harm the body. Next slide, please. Folic acid and B12 deficiency, especially in vegetarians. We used to wonder why vegetarians get heart attacks in the past. We said, oh, they don't eat meat, they're not likely to have high cholesterol. Why should they get heart attacks? This is one of the reasons. Deficiency of vitamins causes an injury to the blood vessels, resulting in heart attacks. So this is a major problem in vegetarians. Next slide, please. Homocysteine levels go up, especially in vegetarians, and this should be looked at carefully today. Treatment is easy, high doses of vitamins, and specifically look at natural sources of vitamins rather than tablets. Look at fruits, vegetables which are rich in vitamins. That will help you. B12 unfortunately does not come from vegetable sources. So you have to have either dairy products, eggs, or some form of vitamin supplements to get your B12 levels up. Next slide, please. There's something called inflammation of the arteries. Inflammation and infections can result in damage to the arteries, and the lining of the arteries can rupture. We now have a test called HSCRP, C-reactive proteins. People with high levels of this in the blood are likely to have rupture of the arteries and likely to have inflammation of the arteries. Next slide, please. I hope it can be seen well from there. This is the artery. And what you're seeing here, this cheesy material, is the cholesterol deposited within the artery. This ruptures, causing blockage of the blood supply in the artery. Next slide. This is the red blood corpuscle, and these are the sticky platelets. These platelets are the ones which stick to each other easily, causing thickening of the blood and forming clots anywhere in the body. Next slide, please. As I said, nutrition in pregnancy, very, very important. Pregnant mothers with poor nutrition have a high risk, and these babies later grow on to middle age and get problems like diabetes, high blood pressure, heart attacks. Maternal health is an extremely important issue for all of us today.